Welcome back to First Coast Living. When is it time to get a second opinion? Will it hurt your doctor's feelings? I know it sounds a little bit silly, but people often wrestle with that question. And the other day I had the advice, or got the opportunity to get some advice from Dr. Scot Ackerman about just when you need to get another take on your situation. Here it is. When you're faced with a serious medical situation, it's hard to know what to do. It's easy to become overwhelmed. That's where seeking a second opinion might come into play. Dr. Scot Ackerman is one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. Dr. Ackerman, thank you again for being here. We appreciate it. So let's get into second opinions. When should a patient seek a second opinion? I'm assuming that this is if they're facing something serious.
Well, absolutely. What I believe and what I always tell my patients and tell my family and friends is that it's important to be an advocate for your own health care. And it's important for you to advocate for your family members' health care. And I'm a very strong believer in advocating for your care. I find that those patients and that either themselves or their family is advocating for the best thing for them actually do better and are much more happy with whatever treatments they do than those that don't. And I think second opinions are part of that process for advocating for healthcare. They're not always needed, however, as you mentioned. Usually it's for things serious. I don't think you need a second opinion for high blood pressure, or if you have if you're just diagnosed with diabetes or high cholesterol, those things that your primary care physician deals with on a regular basis. But more serious things, I think it's good to seek out a second opinion. If you're going to go through cancer treatment, if you're going to have surgery, major surgery, even minor surgery, you can have problems with. So those things, surgery, cancer treatment, dialysis, those sort of things, I think it's very important to get more than one opinion.
And patients usually have a relationship with just one doctor, like an oncologist such as yourself. You know, patients usually develop a relationship with you and might not know where to go for that second opinion. So how do you find someone then to go to get that opinion?
So what happens is when someone has a serious disease or serious illness, they get referred from there. They may go to the emergency room with a problem, or they may see their primary care physician and get referred to a specialist, and they wind up going down the road and seeing different specialists, and then ultimately they see the one who's making a recommendation regarding this advanced treatment of some sort. And many times their primary physician, the one they have the best relationship with, is not necessarily part of that decision-making process. So I think it's always good to circle back with your primary care physician and talk to them and make sure they're comfortable with the person that you're seeing. And if you're a little uncomfortable with whoever you're seeing, go circle back with your primary care physician and ask he or she who they would recommend for this specialized care, be it surgical care, wherever it might be. Also, talk to your family, talk to your friends. If there's a serious issue, frequently that you have a family member or a friend, or one of your family members has a friend that's been through a similar situation and has trust and confidence in a physician, and it's always good to get another opinion. And thirdly is seeking out some of the tertiary centers. Something very serious. A lot of my patients will go to Mayo Clinic, or they may go to MD Anderson, or places, or Moffitt, or places like that for another opinion. Many times it reaffirms what we're going to do, is sometimes we learn something, and sometimes patients come back and decide on a different course of care. It's all good.
Yeah.
From my perspective, it's always important for me that patients are having the treatment that they're most comfortable with, that they've done their research and they want to proceed forward with.
Right.
The last thing I would want is for one of my patients not to get a second opinion and then have regrets later on that they didn't because if they had a poor outcome or something.
Right. More information is better than not enough, or just have that comfort level in what you're hearing from your primary doctor. What about insurance? Because there's been a lot to do about insurance, especially this year. Are second opinions then covered by and large by insurance? And I understand it varies.
It varies. It varies by insurance company, it varies by insurance plan that you may have. But most of them do cover a second opinion for a serious disease. You know, the cost of the consultation isn't really that high, so the insurance companies seem to be okay with that. Because if you're going to be having some sort of treatment, that's where the expenses come in. It's not really the cost of the opinion. But if it's not, so again, the other side of that is, if the second opinion isn't covered, a physician who's giving you that second opinion will probably offer some sort of a price, a self-pay price. And again, it's not exorbitant. A consultation with a physician is usually not an exorbitant amount of money. The high dollar figures are are associated with the surgery or with chemotherapy or radiation therapy, those things could be expensive. But just meeting with a physician for a second opinion isn't really that much money. And depending on the procedure that you might need to have later on, it would be worth the cost to pay for that if you had to. But any questions, call your insurance company ahead of time and see if it's covered, and you can get an answer very quickly.
Yeah, usually you can get somebody on the phone to discuss that. Okay.
Yeah, or the physician's office that you're going to. They usually have people in their office, I do, that will do that check for our patients.
Okay, well, that's very helpful. So ultimately, how do you decide what's best for you given the situation?
Well, when you're going to undergo some sort of treatment, be it surgery or chemotherapy or radiation therapy, there's a few things that you need to consider. One is lifestyle. The other is expectations of quality of life during and after treatment. Another is side effects. The other one is trust in physicians. So let's go through these one at a time. So lifestyle, what is your lifestyle like? When we see women, let's say, for example, women with breast cancer is going to decide whether or not to have a lumpectomy and radiation or have a mastectomy. If a woman's traveling a lot, she may elect to just have a mastectomy and not deal with coming for radiation treatments for 6.5 weeks. So lifestyle, what your work and what your obligations are, that comes into play in deciding what sort of treatment to get, whatever it might be. I'm talking in very broad brushes, very broad generalizations, not just radiation or cancer treatment, but surgery and those sort of things as well. And expectations of quality of life during treatment and after treatment. That goes along kind of with lifestyle. If you need to be functional, and focused at work during treatment, that certainly comes into play in deciding what to do. Also, decide what sort of treatment to get if there's more than one option, or the side effects associated with the different types of treatment. Again, I bring things back to cancer because that's what I know best, and that's what I do. But a lot of times when we look at side effects of having patients can sometimes have surgery for a cancer or radiation for it, the side effects are a little bit different. So it's talking with the physicians, understanding the side effects, and understanding what you want to go through. And the trust you have in the physician. You know, if you're seeing more than one surgeon to talk about the different, doing the same procedure, who you click with. I think you should listen to your gut. Who this person is that you click with, that you understand, that you can trust. And it's good to, again, circle back with your primary care physician, the one that you have a lot of trust and confidence and a long relationship with, and one who knows your complete medical picture to help make you with you to make a decision as to what's the best course of action.
All right. Well, Dr. Ackerman, thank you, sir, for being here. We appreciate it, and thanks for the information, of course, for sponsoring this segment. And remember, if you have any questions regarding this topic or any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is facebook.com/Ackerman Cancer Center.